Okay, so I'll tell you what, since we started recording, I'm going to start us off by saying good evening, everyone. I'm so used to saying good evening, good afternoon, good morning because I work with India a lot, but this is one time zone for a change. So, good evening and welcome to NAMI Tri Valley General Meeting. Today, we are honored to have a very special guest, Liz Perez, the Chief Executive Officer of Access Community Health. As our general speaker, she will provide an overview of Access Community Health and their services, including the Mental Health Urgent Care Program. But before I go ahead of myself, let me introduce myself. My name is Armine Matensian. I am the second vice president of NAMI Tri Valley. With a few of our board members here ourselves, that with our president, Marsha McGinnis, present. I want to say a couple of things about NAMI and our membership. We're here supporting community and the families. We all have loved ones who are struggling. It's not easy when you're dealing with a mental illness in a family and a loved ones that you're dealing with. I've personally been with the NAMI Tri Valley over 12 years, and Marsha, the co-founder, Marsha McInnes, next year we're celebrating our 20th. We provide a lot of programs and we take pride in bringing community members, key programs, key representatives, anything from the legal side to support families. So today, before we get started, I personally want to encourage people that are not members to consider membership. We'll bring that up. Again, it's optional, but we'll take the support, and it's not the financial support we're asking for. It's being part of the community. It's knowing what's going on. So we support all the family members. We are namitrivalley.org on internet. So please check it out and sign if you are not a member. And today's session, we're going to have a relatively short presentation, mostly Q&A. And an Access is one of the key service provider in our community. We need to partner up. We need to know so that we can understand what's going on. I will say more about it, but I want to stop here, turn to Marcia, and see if she wants to address the guests. I always want our presidents to have few words here. So, Marcia,
Okay,
got
thank
the
you.
floor.
I just wanted to mention that we do have a few upcoming activities
Yes.
just to announce. The first that I'd like to let you know is that we are going to have a fundraiser, and this is going to coincide with the City of Livermore's garage sale Saturday that they do once a year, every third Saturday in June. So this will be on June 20th. We're not having a garage sale, we're having a higher end yard sale. Okay. So there have been some incredible donations of items that we would love to have you take a look and see what we've got. It's going to be all day. It's going to be fun. So I really hope that you do come, and we'll be sending out flyers soon. Let me get one more person on here. The other thing that we're going to do is be able to provide a training for family caregivers, and this is on safety planning. This will be given by two clinicians that will be training live. This will be in Livermore at the Common Point Nonprofit Center and in the conference room, and the same location as where our office is. And this will be June 27th from 10 in the morning till noon. That's a Saturday. And if you're interested in learning more about this, then please do go online, namitrivalley.org, and register so that we know how many people will want to get trained. So I think those are the two main ones that I wanted to share. Hey, thank you.
Thank you very much. So, before I turn the podium, the stage, the mic to Liz, I do want to say a couple of things about Access Community Health Center. Okay, Access Community Health provides affordable medical, dental, and mental health services to residents in a Tri-Valley area. They offer comprehensive care regardless of insurance, utilizing a sliding scale fee for eligible low-income patients and assisting with Medi-Cal, Medicare, and covered California enrollment. Liz herself started her career at Access Community Health in 2013. When she became the director of clinic operations, she then worked as the chief operating officer and was selected as Access new CEO in 2023. Liz earned her degree in psychology at Southwestern University and her master's in mental health counseling at Georgia State University. She is dedicated to breaking down barriers to healthcare, advocating for policy change and partnerships with community organizations. Now, just this sentence alone tells you why we're so in line, and we are really honored to have you here, Liz. So let's turn this to you. We want to hear from you and then open up to Q&A. Thank you for coming. So, and you got the floor.
Great. Thank you, Arminette. Thank you, Marcia. It is really an honor to be here. I'm Liz Perez-Howe, and I have the privilege to serve as the CEO at Access Community Health. If it is a calling for me. I'm a trained therapist, and after doing some work in the counseling field, I wanted to continue my work in social justice mission and came to Access, and it's truly a privilege. So I wanted to first start off to express my deepest gratitude for NAMI and for everything that you all do, your advocacy, your peer support, your crisis resources. You are there for the community. You hold invaluable resources that are so important for our community. And we're just really fortunate to walk alongside you as partners in this work. So thank you so much for the invitation to be here. So today I just wanted to walk through Access as a whole and just give you an idea a little bit about our history. Similar to NAMI in general, got started in the 70s, so we have a pretty rich and long history. So I will walk you through that. So a little bit about our mission. We are a nonprofit community health center, and our mission is to provide quality, affordable, accessible, and compassionate healthcare services that promote the well-being of our community. We serve primarily the Tri-Valley. We also serve southern parts of Contra Costa, San Ramon, and Danville. And we are one of 8 community health centers in Alameda County, but we are the only one in the Tri-Valley. Here. A little bit about our history. So we began in 1972. And back then, there was a group of women that were concerned about the fact that in the Tri-Valley, there was not enough resources for children that did not have access to health care. And so they saw a group of children that were low income and under-resourced, excuse me, and they went to Alameda County and began advocating. And they got loud, and they got Alameda County's attention. And they formed a group called the Healthcare Concerns Committee. And after successful advocacy, they were able to form a nonprofit. began what's now Access Community Health. That picture there, the three in the middle there, are the fierce warriors for the start of Access Community Health. We used to be called Valley Community Health back in the 70s. And so we started in a very small house in Pleasanton, a very small staff, with really a staff of three, and began providing free medical services to children.
Mm.
And then through the years, the clinic grew slowly in the early years. And then we started to expand services. We first expanded services to adults, under-resourced adults that did not have health care. And then we moved over to a small apartment complex in Pleasanton, for which we're still there. We then added WIC nutrition services. And then in the 80s, we added a new site in Livermore. So as the community needs expanded, so did we. And then we rebranded from Valley Community Health to Access Community Health. The main reason for that is if you've been around here long enough, you know that the hospital used to be called Valley Community Hospital. And so everyone kept confusing us for the hospital. So we changed our name to Access Community Health. And then in 2009, we gained federally qualified health center status. And what that means is that we were able to access some federal funding to allow us to have a sliding fee scale that subsidizes that sliding fee scale that we have for all of our services for everyone in the community. So that was a really important time in our history. And so then we began growing. Back in 2012, we opened our building, our largest building in Pleasanton, which is on Las Positas. Las Positas Boulevard. This was at a time when the Affordable Care Act had been passed, and we were beginning to see a number of community members that had never seen a doctor before. They never had health insurance. They were simply just accessing care when they needed it at the emergency room. And so through the Affordable Care Act, they were able to access services with a doctor through Medi-Cal. And so we saw that there was a huge need, bigger than we thought, in the Tri-Valley. And so we built the building that is on Las Positas Boulevard. It's 22,000 square feet. It has 22 exam rooms, 9 counseling rooms. And even then, we saw that it didn't meet the need. So, for many years, I think there's been an understanding in the Tri-Valley that maybe there isn't too much need over here. But in fact, there is much poverty in the margins, and there is so much need in the Tri-Valley. And so that has been our goal, to continuously advocate for this side of the county, the eastern side, and ensure that that it's known that services are needed here. So that's on the left, that's our kind of our Pleasanton headquarters. Then on the right there, that's our original site in Livermore, because we now have a second one. And that's in the Multi-Service Center in Livermore. We've been there since the 80s. We've seen it change a lot. We now share space with CityServe, which is fantastic because we're able to provide coordination of services with CityServe. We have the original apartment building on 4361 Railroad Avenue. Been there since the 70s. That has been refurbished quite a bit. And now it holds, still continues to hold medical care. But we have also partnered with Stanford Health Tri-Valley, the hospital. They have established a residency program for new physicians. And so we're part of the teaching program with the hospital. So their residents come to us several days per week and see our patients. And it is our opportunity to help incoming physicians understand community health and public health and have them work with our community. So it's our way to ensure that we are providing new physicians that really understand community health. So it's a great partnership. We also have our Dublin site, which is primarily dental. We have
Mm.
our standalone WIC site, which is in Pleasanton. And then lastly, we have our newest location, which is in Livermore on 2nd Street. This thing seems to have a mind of its own. Sorry about that. We opened this building in January of 2025. And this was uh, a long time goal, finally actualized. We had been looking for a building in Livermore for almost a decade. And it's just very difficult to find buildings that you can convert into a clinic. And so we did finally find one. And it's our first medical hub because it holds medical, dental, and behavioral health all under one roof. So it's really exciting for us. We serve almost 16,000 patients each year, and the majority of those do live in Livermore. So we knew we needed more space and access in Livermore. So that's been really exciting for us to see that come to fruition. So this is an impact snapshot of our services, just to kind of give you a global view overall across all of our service lines. So in 2025, we provided more than 118,000 healthcare visits to close to 16,000 community members. We offer an array of services, as you could see, primary care, which is adult, it's pediatric, it's geriatric care. We have OB, we have family planning, acupuncture and chiropractic, dental services, integrated behavioral health, um, a mental health urgent care, which I'll get to in a moment, and then some support services like case management and enrollment assistance. Enrollment is really key for our patients because if you've ever navigated the web of health insurance enrollment into Medi-Cal or Covered California, it is a complex process. And we want to ensure that we have a case manager that is available for community members to walk them through the application process. And that's exactly what we do. We provide the service in both English and Spanish and have telephonic interpretation if they need it. So it's a big piece to help individuals stay on Medi-Cal. And then this is an impact of our patient portrait. So as I had mentioned earlier, 40% of our community members reside in Livermore. And so we were very anxious to get a new Livermore building. Then Pleasanton, Dublin, San Ramon, and then a little bit of across Castro Valley. But the primary community members reside in the Tri-Valley. We primarily serve the under-resourced community. As you could see, 82% of our patients are at or below the federal poverty level. And so what that means is that for a family of four, their income is generally about 24,000 annually, and thus they do qualify for Medi-Cal. 81% of our patients have Medi-Cal. As far as race and ethnicity, we mirror the diversity of Alameda County. Our providers speak over 20 different languages. Our frontline all speak Spanish, and then we provide telephonic interpretation for anyone that needs it. And we are the sole safety net of the Tri-Valley. As the safety net, we don't just serve the under-resourced at the moment, but we are there for adults and families that are in transition. For example, during COVID, we saw that many individuals lost jobs. And generally, when you lose your job, you lose your health insurance. And so we were the stopgap or the bridge to help individuals while they were in that middle period. They didn't have a job. Extending your health insurance through Cobra can be very expensive. And so we provided care for anyone that needed it, and they could use our sliding fee scale. Excuse me. This is a snapshot of our ages. We are seeing more and more seniors. We have 22% of our patients are 65 and above. About 5 years ago, it was 11%. So our patient population is aging, which is it's exactly what's happening in the Tri-Valley as we see it. Our top patient diagnoses, we track everything in healthcare. We track it for trends. And as you could see, we have our top 3 diagnoses, which have remained consistent for many years, which is hypertension, behavioral health, and diabetes. And so we see many individuals coming in, presenting with depression, anxiety. It's actually our highest percentage, as you can see. So huge demands.
Mm.
And really what we do, our philosophy of care is whole person care. And so, we started down the path of primary care, but then we began introducing integrated behavioral health care, which started in 2012. And this is an evidence-based program that enhances patient outcomes. And what it means is that behavioral health and our therapists are not kind of off to the side in their own building or requires a referral or anything like that. They're housed right inside of our clinic. So a therapist's office can be right next door to the exam room. And what we do is depression screenings for patients that are coming in for medical visits. If they score high on the depression screening, we initiate a warm handoff, and we talk to the patient and we let them know we see that you're struggling. Allow us to, bring a therapist in, and the therapist will go into the exam room and talk to the patient. And that is our way of decreasing the stigma of mental health and helping patients access care that maybe they would not have initiated on their own. It helps us catch it too. If you're not coming in for a patient visit, you're not necessarily going to reach out to a therapist because you need support. And so we do screenings everywhere in our medical clinic, we do screenings in our dental clinic, and we really focus on integrating behavioral health. Excuse me 1 minute. Sorry about that. Allergies are getting to me. As part of whole person care, of course, we started dental in 2019 with our first dental clinic. And then we introduced chiropractic and acupuncture services for pain management. So those have been programs that have been responsive to community needs. And then I'll talk a little bit about behavioral health. So currently we have around 25 therapists, and they see about 700 patients per week. Most of our our patients are on Medi-Cal or utilize our sliding fee scale. We provide individual counseling, couples, family, groups, and lots of care coordination. We really focus on care coordination because we know that there are many social drivers of health. We know that sometimes patients present with anxiety or with depression because they have housing instability. And so our care coordinators will work with these patients to help connect them to resources to help stabilize their lives. So care coordination is a really big piece of what we do. We provide psychiatry, and we also have an intern program. We have 6 interns that are currently working under licensed therapists that also provide services to our patients. Then we have our Access Bridge mental health urgent care, which I'll talk a little bit about. So this program began about 5 years ago. We would frequently receive calls at our access center, our call center, from community members that were desperate for services. They were at or near a crisis. They were reporting 3 to 5 months of a wait time to see a psychiatrist, and sometimes up to 2 months to see a therapist. And it just broke our heart that we would have to turn them away because we didn't have immediate access to a therapist. And so that is when this mental health urgent care program launched. And it is the brainchild of our chief of behavioral health, Dr. Jennifer Penny. And so she took the primary care, mental health urgent care, and or primary care, medical care, and kind of just turned it into a mental health urgent care program. And so this was a way for us to respond to the increasing need for mental health services. We know that in particular, Livermore has a very high rate of depression rates. And so we needed a way to be responsive to our community. And so with funding from the cities and from Alameda County, we launched this mental health urgent care program. It is a free program to the community. So anyone can access it, even if you have insurance. But if you are at or near an urgent situation, an emergent crisis, we provide same day or near to same day access to a therapist. We have a psychiatrist that will also be able to see you if you need medication. And then we provide care coordination to help link you to longer term care. So in the last 5 years, we've seen that we help about 1,000 members each year, ages 5 and up. We have had a 5-year-old that was in crisis. And so the goal of this program is to, first of all, reduce the number of emergency room visits for mental health. We know that, the emergency room is not a place if you're in a mental health crisis. It's also to reduce calls for assistance from law enforcement. So we work closely with Pleasanton ARU, with Livermore's program. If there's an emergent mental health crisis, they can refer them to us. It's also to reduce involuntary psychiatric holds. We know that that is a secondary trauma to many patients. And so our goal is to be able to immediately see them and provide short-term therapy. And we have a staff of 3 to 4 therapists, and most of our patients have about 5 visits with a therapist. They will see the psychiatrist if they need some medication management or initiation of medication. And then we link them with a care coordinator to help them be able to establish long-term care. So sometimes our patients come in and they do have private insurance, but they are not able to see a therapist right away. And so our care coordinator will work with them, work with their insurance to try to link them to longer term care. So we've seen great success with this program. We track if anyone has to go on to a 5150 or psychiatric hold. It's less than 2%. We're able to stabilize them and then link them on to longer term care. So it's a response system for what we see, the community needed. It's free to the community. It's open to the Tri-Valley, and we're available Monday through Friday. Um, so yeah, so that tells you a little bit more. We partner with local agencies. We do partner with the hospital as well. And that concludes my presentation on our history, and I'm happy to take any questions. Sorry for this throat scratchy. The allergies are getting me.
Thank you so much. That was awesome. That's a great way to start a conversation. So, folks, there's such a small group. I encourage that you can unmute myself. There's a button you can raise your hand or just speak up. We'll try to manage traffic. You can also in the chat write down your question if you absolutely don't want to participate in a conversation. Either way, we're open and we'll just open it up for questions. Go ahead, Marcia.
Yeah. Um, so Liz, does Access Community Health also collaborate with or have any relationship with Kaiser, with Sutter, with John Muir, with Stanford Valley Health System? I know Stanford you do because you mentioned that, but
We do with Stanford. We have the residency program, and Kaiser has been a supporter for our services, and so they generally provide us with some grant funding for different initiatives. So the last couple of years, they have helped us. They've provided support for a nurse practitioner. Same thing with Sutter. Actually, Sutter, for the last 3 years, they have supported the Access Bridge program directly. They have been a huge supporter. So our funding for Access Bridge has shifted through the years. It started off with the three cities and the county, and then primarily became Alameda County, which we were grateful for. And then Sutter Health came in the last 3 years and have provided substantial contributions towards the program. And that's why we're able to offer it for free to the community. So,
hey, thank you.
yeah.
But your services, it's not urgent care where someone with a problem with physical, mental can just walk in, right? They need appointments.
Well, in Access Bridge, they do not need an appointment. They
It's the
can,
bridge. Yeah, okay.
yes, yes. For medical care, all of our providers have what's called same-day appointments. So you can always call our call center and ask to be seen the same day. And so what we try to do is avoid visits to the emergency room. But depending on the situation, if it's not appropriate for outpatient, obviously we send them on to the emergency room. But we have several providers whose main goal is to be an urgent care medical provider. So,
Okay.
mhm.
So when it comes to mental health or mental illness, your clients are not the critical need. What's the level of support that they get?
So we would be considered mild to moderate.
To
And we
mother.
do see some that are higher on the scale, which we, then sometimes work with the county to refer out if needed or help them access, intensive outpatient if needed. But we are primarily in that moderate state. Hmm.
Okay, that's good
Yep.
to know. That's good to
Hmm.
know.
Hmm.
Any questions, jump in because I can manipulate this conversation with her. I'm resisting myself not to talk too much. Any questions from anyone else?
I might have just, I mean, a comment. I have so many things in my head that um, I wanted to mention that my son, um, he's had during that pandemic,
Mhm.
um, he was homeless, living out there, and one of the people that were working out there, Donna McKenzie, uh, she was told that my son was not seeing. He was he's diabetic, and he was uh, told to go. We were told to go have him checked out, and so we did that, and we went to Access Community Health. I don't know how we arrived at it, but that's where we were sent, and they took very good care of him. Um, Donna McKenzie, she was able to go get have my son with an apartment in Pleasanton. This was during the pandemic, and being homeless and just going into an apartment. That transition for him was not good. It was just he didn't know what to do with himself. He had a you know so uh, the housing abode they supplied him with
Mm,
furniture. They just progressively he started to be able to live inside of an apartment in Pleasanton. Um, also, he had a caseworker. I want to call her a caseworker, Eileen Esparza.
oh, I know Eileen.
Yeah,
Yes.
she
Hmm.
was his because he could not see. He couldn't call people. He couldn't read the washing machine or the thermostat. He did this and that. Um, she set him up with appointments. It just goes on. And
Hmm.
during this program, um, she just helped him immensely. And someone would go to his apartment, check his legs for his
Hmm.
diabetes, and it was just working very well. Now, of course, my son being an addict, um, he was very particular who came to see him. He wanted his
Hmm.
privacy, et cetera, et cetera. So it was hard to work with him. At first,
Hmm.
I had um, um, right of information at first, but then he took
Hmm.
me off. So the reason why I came to
Hmm.
you to this meeting is because as a person who cannot see, uh,
Hmm.
he has a dog. We told him to go to Lighthouse for the Blind, but he didn't want to go that route. Someone gave him a dog, and he had to learn how to clean up, take him for walks. My son would get lost, and
Hmm.
it's just one thing after another. Now, what I would like him to do is to live in a group setting
Hmm.
where, because he gets along well with people, but him being blind uh, or legally blind, it's very
Hmm.
difficult for him. Everything has to be voice activated.
Yeah.
We have Alexa for him. Just little by little, we're trying to piece this together.
Hmm. That
Um,
is lots of complexity to
yeah.
try to piece
So
together.
yes. So any help that I can get or a direction. Now, mind you, a mother's direction is different than your son's direction, but I appreciate everything that Access has done for him, even transportation, um, everything. Not that he took all of the um, opportunities, but they offered this to him, which I was very grateful for. Thank you.
Thank you for sharing that. And we will be here,
Yeah,
if he
yeah.
needs services, and I'll be sure to let Eileen know. She is actually working on her master's to become a therapist. So I'm very
Oh,
happy.
great.
Yeah,
Yeah,
yeah.
she moved to LA. We miss her very
Hmm.
much.
Yeah, yeah.
So
She's
thank
great.
you. Yeah.
Thank you for sharing that.
Mhm.
Thank you for sharing, Marie. It's
Thank
the community comes together here. We don't just bring our problems, we bring our success stories too. So yeah,
Yeah.
let's turn to John Bauer. John, you raised your hand. Please go ahead.
Okay. Yes, I raised my hand. Good evening, everybody. You just mentioned something that we went through a lot with our son, back 8 years ago. You said that you refer out. And my question is, where do you refer out to? Because when we had challenges with
Right.
our son. We called, every emergency, basically we looked at it. We had one shot to get him into, get him help from somewhere. And we didn't want to take him into, for example, Stanford Valley Care because, I called them up and, tried to find out what the process was. And it was like, well, if you bring him to the emergency room and we'll refer out. And, I heard that from really, every medical provider um, that we reached out to. So what does refer out mean to your organization, and what is that process?
Yeah, it's a great question. And unfortunately, there aren't many resources. There just aren't. I mean, for higher level care, there is John George, which is in Oakland, and that's our county mental health hospital. So when I say if somebody is really in a mental health emergency crisis where they will um, at risk of harming themselves or others, then they do need to be referred out to John George where they can be held. So that's like the last resort. If somebody needs a higher level, like intensive outpatient, we do have a list of resources. Off the top of my head, I don't recall. I would have to check with my chief of behavioral health. But I'll be honest, there aren't many in the Tri-Valley or in Alameda County as a whole, and there are long wait lists. And so our care coordinators start getting creative depending on what the patients need. We'll work with Alameda County's behavioral health department to help us with someone that needs a higher level care. Like Cherry Hill, for example. So there's a list of resources. I don't have that accessible to me, but part of the Access Bridge program is to try to de-escalate before patients need higher level care. And so we try to care for them by seeing a therapist in-house, seeing a psychiatrist if needed to try to stabilize. And that was part of the vision or the strategy is to try to keep patients from escalating and to keep them in their homes. So I apologize, I don't have the names of the resources
Yeah.
available for the county.
Okay. All right. So let me ask this. Once again, this goes back, 7, 8 years ago. But we, did try contacting the county.
Mhm.
And I don't know if this still exists or not, but when we did contact the county, our son, was employed, and he had excellent private health insurance. And we were told by the county that they only accepted Medi-Cal patients. Is that still a true statement?
That is true. Sadly, that is true. And, we were seeing similar to your story, individuals with health insurance that needed to see a therapist right away, and there was still a month wait or 2 month wait. And so Access Bridge came along so that it didn't matter if you had insurance. You could try to see it, you could get to a therapist. But for Alameda County, they are positioned to help under-resourced individuals that don't have insurance to try to stretch their resources as much as possible. So I hear you. I hear you. Our care coordinators work with the individuals that come into Access Bridge with their insurance. So sometimes we're calling Kaiser, sometimes we're calling Cigna to try to get them connected with a therapist and advocate for them because a lot of times patients, if they need help, they also can't be their advocates. And so that's a big piece of the role of the care coordinator is to kind of be that person that holds their hand when they need that support, because it's a challenging process.
Okay. And then, over the last, like I said, 8 years now, I've had my, let's just say, finger on the pulse of, the mental health community. And what I have observed is that certainly the need is great, but the resources are very small. And that the people that are the providers are generally underpaid. Um, and I'm going to say this, but no disrespect is meant by it. But unfortunately, it's a field that is dominated by females who are in practice, and that's because it doesn't pay that great. So my question for you is, with the pressures on those that are providing the care in your organization, what's the turnover in your organization, and kind of like what's the mental health of the people who are providing the care? I see it as an industry, with a lot of turnover. It doesn't pay that great, and it's kind of like to an individual, kind of like it's you ask the question, why am I doing this type of a thing? So, what's the sense of the moral? Not the moral, but the I guess what I'm asking for is, how is the turnover in your organization? One, do you see a lot of turnover? And two is, how is the mental health of the providers in your organization holding up?
Yeah, yeah. No, those are all really valid points. And so part of our mission is to ensure the well-being of everyone that works at Access. So part of our strategic plan is to make sure there is a lot of provider wellness. That is a part of what we do. We allow for a lot of flexibility for our providers. They can work from home, they can do telehealth, they can adjust their schedules. And we find that that's the most important piece to ensure that there's a work-life balance. We do try to be as competitive as possible with the market. We know there's a lot of competition. However, a lot of the work that we do is dually missioned, which means there are therapists that do this work because, of course, they are passionate about helping mental health. But Access as a whole is also a mission to provide community health to the under-resourced community. The community health center movement is a movement that started over 60 years ago to provide equitable services. So there's a dual mission for the providers that work for us. I am thankful and grateful to say we actually do not have a lot of turnover. Many of our providers have been with us for 5, 7, 10 years. Our chief of behavioral health has been with us for 15 years. And so we ensure that we're listening. We are trauma informed as a provider and that we are ensuring that all of our employees are taking care of themselves because they cannot drink from an empty cup. So that is a big part of our values. I am a therapist. As a CEO, I can't separate myself from being a therapist. I want to make sure that all of our employees are well. So I hope that helps.
Great. Thank you for your answers.
One of the things that amazes me about the services you have is the dental coverage. Generally, vision and dental is left out even at the better plans for the people that are not on Medi-Cal, right? Just to have that is incredible because coming from our families, our loved ones, mental illness takes a big toll on anyone's health. And teeth, especially if there's any sort of addiction involved substance use, is like scary. And half the time we cannot get them to go to the doctors, never mind dentist. And I had several appointments for my son. Every time came, he wasn't well enough to go. And I don't want to lose the spot, so I schedule another one next 6 months. So first time I did it, I was shocked. I waited 6 months to be able to make an appointment. And then it was, but what's the wait for like some services like that?
Yeah, so the Tri-Valley is a dental desert. Okay, so what that means is that there are so few dentists that accept, it's called Dent-A-Cal, that it's considered a desert. So that is a service that is probably most needed in the Tri-Valley right now. So we opened up the Dublin clinic, and immediately we had 1,000-person wait list, unfortunately. So we expanded services in Livermore, and our wait list, I have to be honest, has not budged too much because once people come off that wait list, new people come on. And so we prioritize children, we prioritize our prenatal patients, we prioritize seniors, and then, we work from there. We also allow for emergencies, kind of like that
Mm,
same day
yeah.
concept. But it is a huge need. And unfortunately, there are some changes with Medi-Cal coming and dental, which is going to prevent many, even more individuals from being able to access services. So, yeah, it is challenging. It is
Can you
definitely
try to
challenging.
partner up? Can you try to partner up with some dental schools? I know when I was in New York, interestingly enough, well, we were immigrant those days, we didn't have much money, but schools, obviously you worry about the quality of service and all that, but they're getting there. There's some eager students are better than some careless, doctors, to be honest with you, but it doesn't matter. It's just service. I was wondering if there's any out-of-box thinking involved in this area.
So for access as a whole, our kind of sticking point isn't actually dentists. We can actually hire dentists because for many dentists coming out of dental school, they don't have to worry about starting up a new practice. We have a lot of infrastructure to help them, get confident in their skills. It's dental assistants that is challenging because those are there are limited schooling options for dental assistants. So we have conversations going on with Las Positas College and Tri-Valley Career Center to see if we can get something to initiate more dental assistants. The more dental assistants we can have, the more dentists we
Mm,
we can also have. So yeah, good
good to know.
question.
Good to know.
Yeah.
Do you, any chance, do any community training, like classes on health and diets and all that?
We have a nutritionist on staff that provides nutritional counseling for our patients. Right now, there's only one, so we limit it to access patients, newly diabetics, those with uncontrolled diabetes. So we prioritize, but that is an area actually that we are hoping to expand. Um, that as well as we're doing some menopause groups for access patients, for women that are struggling with that transition. So we're looking at
Mm.
a few out-of-box things that people are asking for. So those are services that are definitely needed.
There's so much happening online, internet. You can find information about anything, but we don't have that contact, and you got the facility, and I don't know what the limitations are. A lot of times, security and safety and all that, but some small group classes and discussions where people can come and share, that would be great. And that would be great to partner up with organizations, other nonprofits.
Yeah.
We do suicide prevention workshops and we do all kinds of different workshops that we can share back and forth and let our members know about what you're doing, let your members know what we're doing. So it's,
Yeah, that's
And
great.
and we're ready to partner.
yes, yes,
Yes, that's great. We do try to do as much as we can with Tri-Valley Nonprofit Alliance because they are kind of like the connectors of the Tri-Valley for a lot of the nonprofits. So
yes. We're all in the same boat and we're
yes,
trying to help our community.
yes.
That's awesome.
I actually have a question for you, Liz. Um, did you or did Access Community Health lose much federal dollars?
Yeah, the big one. Um, There was a very unstable time for us at the beginning of January because our federal funding was on hold. So that was very challenging. Uh, but that was reinstituted. Then we went through WIC holds, CalFresh holds. So we've had a series of different disruptions in the last year. Fortunately, the main funding for community health centers is still intact as of now. So hopefully that does stay. But what we are getting ready for is the changes to Medi-Cal that is coming in January, where a work requirement is going to be instituted, as well as 6-month redeterminations. And that will be very impactful for our community members. Most of our community members work, so they'll meet the requirement. The issue will be is helping them navigate this process, getting the paperwork in, then coming back 6 months later. And so that is the main focus right now is to ensure that everyone possible stays on Medi-Cal. So yeah, there's a lot of change coming for our Medi-Cal community.
Thank you.
But I just wanted to note, we provide a lot of hand holding for anyone that needs help getting onto Medi-Cal. So they can establish an appointment with one of our enrollment counselors. They have 45 minutes to 1 hour appointments. They walk them through the whole process and help them because it is a complex process.
Yeah. What happens to people if they don't have mailing address? So if somebody's unhoused,
Many of our patients will have a PO box. I know CityServe also helps some of our unhoused community members that they can assign. And then sometimes if there is something, we find many of our unhoused members do have cell phones. So if there is something important, we will call them. And if there's something that they need to pick up, then they can pick it up. We just try to help them be creative, try to have a PO box or try to have an established address, either through CityServe or another CBO that allows you to do that. I know Open Heart Kitchen has mailboxes, so slowly more resources are opening up for our unhoused community.
May I ask another question? Um, as far as the enrolling in Covered California, is this a service that anyone that is looking for insurance, particularly the younger set that are just turning 26 and have no other means to have health insurance, is that something they could set an appointment up with?
Oh, absolutely. Yep. We have what's called certified enrollment counselors. So that means they've gone through the state of California's training program and we'll walk them through the whole Covered California process. That one's complex too, because there's different tiers. And yep. So we help them and try to help steer them to, what's going to be most appropriate for them. But yeah, they don't have to be access patients. They can just set up an appointment and we'll walk them through it.
Thank you. Great.
Yeah. Yep.
the one set of population that suffered are the young students. I know if they're in college, I know my own niece is very frustrated because she's about to turn 26 and she's going to lose all the benefits, no more medical from the family, right? And she was shocked how much more expensive, and because she thought she would qualify for Medi-Cal, but she doesn't. And it's a lot of money for them.
It is. And there are a lot of individuals that are in that gap where they just barely make more than what's what you
Minimum
can,
requirements.
right, for Medi-Cal, but make too much for others, sorry, I'm saying that wrong. Make too much for Medi-Cal, but too little to be able to afford like a covered California. So they kind of fall in that gap. A lot of times people go without insurance, and we see them at the health center with a sliding fee scale. It's not ideal, but it is a possibility. But yeah, we have many individuals in that gap. And it is expensive. It really is. And now, without subsidies, those were really helping a lot of patients.
So at the end of the day, you guys are nonprofit. All
Hmm.
the activities, everything run nonprofit.
Yep. Yep.
How many doctors overall you have in all the locations?
Um, our last census, we had about 28 providers. We have MDs, DOs, then we have advanced practice like nurse practitioners and physician assistants.
Ar-
And then we have about 25 therapists.
Armine, Armine,
Yes.
John has his hand up again.
Oh, I thought it was from last time. John, please go ahead.
Okay, thank you. I was hoping you could address exactly how you guys are funded now. You stated that in the beginning that, it was the cities who, funded you. I know Pleasanton, over the years has, been when it had a lot of, much more money than it's got now, was a big funder of your organization. Um, but now, I guess my question is, I've heard that you are now being funded by Sutter and Kaiser, and my question with those two is, to what benefit and why would those, let's just say, private, organizations fund you? And now, also, I believe you stated that the county is funding you. And is there any risk with the current, county budget looking not so great, of any cutbacks? And yeah, so could you just briefly give us a quick, kind of, top level view of the funding and, which of those streams could possibly be at risk to your organization?
Yeah, absolutely. So, Sutter and the county, the funders I was referring to, they fund only the mental health urgent care program. So that allows us to provide the service for free. And the reason they do it is to prevent emergency room visits for mental health emergencies, which ultimately ends up costing the whole system much more money. So the more we can keep individuals out of the emergency rooms, the better for everyone. So they only fund that program. Then Access as a whole, we we bill insurance primarily. So only about 10% of our funding is a federal grant and donors. Everything else is we bill out for insurance. So that's our primary revenue stream. So that's Medi-Cal and Medicare, and then a little bit of covered California.
So the county only provides the funding for the mental health program, none of the other services?
They provide the funding for the mental health program, and then they also provide funding for indigent care. And so they do provide a grant for those individuals that are in the county that do not qualify for Medi-Cal.
Okay, great. Thank
Hmm.
you.
Yep.
So can someone work in, let's say, the acupuncture services, they have to be a member? Can someone come in and pay cash for those services?
Certain services are open to the community. Acupuncture is one of them. Chiropractic care is another one. Our most of our programs are are primarily for access patients, those that are on Medi-Cal. Since our mission is mainly to serve the under-resourced, we want to make sure that we get to those patients first before we open it up to others. But there are some programs like acupuncture as a great example. There isn't a huge demand for it, so we're able to open up those services for the community. Great question.
People always ask me about acupuncture locations. You get a good person, you don't know what you're missing. If you okay.
Yeah, yeah.
That's very good. That's very good. Um, we definitely need to have you back periodically so people can hear and understand, and all of us get educated. And we are very nervous with this political turmoil and jobs. I am in Silicon Valley. Tens of thousands of jobs are lost, and people don't understand. I used to be a financial advisor. There isn't a big line between what people think the middle class and losing everything. It's scary. And communities, we don't have much to offer. Services are shrinking and centers are just harder to come by.
It is.
That's why we want to know what we can do to help you. Uh,
Yeah, absolutely. I always tell all of our partners in the community is let people know that we're here, even though we have been in the Tri-Valley for 54 years. Sometimes I come across people that have never heard of Access. And so just share that there is a safety net in the Tri-Valley. They can, if they don't have insurance, we do not want them to go to the emergency room. We want to help them manage any chronic diseases and stay healthy. And so it is to spread the word. And then come January, it's also going to be about spreading the word about Medi-Cal. It is going to be very disruptive for everyone on Medi-Cal, instituting all of these changes. And so that will be key is to evangelize everywhere to make sure that they stay on Medi-Cal because it's going to be a process every 6 months. And so a lot of education around that. So yeah.
so do you have the proper personnel to hold hands and explain these things to people, right?
We do. It's part of our strategic plan to expand um, that personnel, the enrollment specialists that are needed, because now we got to do double, right? Every 6 months. So we are expanding our services and trying to utilize technology as much as possible to expand our reach as well.
That's awesome.
Mhm.
And I do have to take opportunity to congratulate and thank you because most of my life in America, I lived in East Coast. And whenever there is any program that's Medi-Cal related, you go, the building is run down, there's always old and beat up. In Pleasanton, you go to Access Center, you go, oh my God, this is Medi-Cal. Am I in the right place? So, Marcia and I had several conversations that our loved ones deserve
That's
deserve that
right.
facility, and it's
That's
so
right.
beautiful.
That's
And
right.
same with Livermore too. I know it's a little older building, but you guys doing a great job. Marcia and I were there at the opening ceremony, so it's wonderful. And our
Thank you.
office being downtown, we're not too far, we're walking distance.
Yep, thank you. That's exactly right. Our patients deserve the absolute best in care, the setting. They deserve to feel special, and that is our goal. So thank you for noticing.
Yes, we do. Yes, we do. And they
Mhm,
do too. You walk
mhm,
there from all walks of lives and they feel special.
mhm. That's exactly right. So, yeah.
Liz, just
Mhm.
real quick, if I'm a Kaiser member, but if I wanted to ask of your services at Access, and I've been there several times to take my son, 'cause he's, we take him. Um, what was my question? Who can I speak with? For example, if he needed mental health, or I don't know if you have services for people that are blind, but any kind of questions, who would I contact? Because yeah, it takes a little bit to get in through those channels when you're calling up.
It does.
Yeah,
We're working on it,
yeah,
but I
yeah.
know
Oh,
it
yeah,
does. It
yeah.
does. So, are
So,
you asking about services for him or for yourself? Because you mentioned you had Kaiser. I'm sorry.
Yeah, I have not for me at the moment, but for
For
him
your son. Mhm.
also. If I have a sister living in Tracy, could she apply for access or your yeah?
Yeah.
Okay.
So Tracy is would be San Joaquin County. So
Oh,
yeah. So there's a community health center close in Tracy. It's called Community Health Center
oh,
that she
okay.
could visit.
Okay. Thank
And
you.
then for your son, he's a previous established patient. So it would just be a matter of setting up a first appointment to reestablish care. So
Oh,
we're working on our call center to decrease the hold times.
yeah.
But we instituted a callback service. So if you just want to leave a message and wait for somebody to
Yeah.
call you back,
Yeah.
you can do that as well.
Yeah. They've been great though. In any case, I thank you for that. Mhm.
Thank you.
Okay, so Jim, we noticed that you just joined us. We're going through Q&A. We heard from Liz about 25-minute presentation, and we're just sharing ideas, asking questions. Feel free to join into conversation. We have another 15 minutes to go, and we will give everyone a chance to participate. So your patients have to be from Tri-Valley?
Um, from Alameda County or Contra Costa County. Those are the
Okay,
two
it's a
contracts
county.
that
Okay.
we have for Medi-Cal. We do see sliding fee members from other counties, but that um, is it's limited, right? We can't really do a referral to a specialist if you don't have insurance and if you're in another county. So we try to direct individuals to a health home that is makes sense for them, that it's closer to their home and so forth.
Okay. And there was a talk, I think Marie talked about the transportation. Do you provide transportation or it's a separate nonprofit?
So we have a contract with Lyft if a patient does need access to their appointments or to a specialist. We also provide bus vouchers and or coordinate if they do have many of our members have program. Is it Tri-Valley Wheels? I can't remember the name of
Yeah,
it.
it's
Yeah.
Wheels.
So we
Something on
coordinate.
wheels too,
Yeah.
yeah.
So we coordinate with them as well. So yeah, we try to help them get to us as
Okay.
much as possible. And then of course we do a lot of telehealth. So they don't have to leave their
Mm.
home. And we provide our services for behavioral health as well as medical care via telehealth. So that could be a phone call, it could be a Zoom call, whatever, the patient feels most comfortable with. So telehealth has been great to eliminate access barriers for many patients that, just found it difficult to get to the clinic.
That's awesome. What percentage would you say appointments are happening on Zoom or online?
Yeah, so for medical, it's about 50-50.
Wow.
And for behavioral health, it's a little bit higher because so many of our patients want telehealth, behavioral health visits. It's maybe about 80% or so. If our patients they find that it's just more comfortable for them, they're at home and in a private space, so it works out well for them.
Wow, that's good statistics. Thank you. I didn't realize that. But we'll all change our lifestyles and habits. Before COVID, none of us would have guessed that. It's like, whoa.
Exactly, exactly. I mean, that is one thing that came from COVID is we learned how to be a little more flexible and use our technology. So I know many of our patients would have to take a whole day off of work to get to an appointment, and now it's, they can just schedule out 30 minutes on their lunch break and be able to see their provider. So very helpful.
Yes. Yes. Well, thank you. Even this meeting is an example. We used to always meet in a library. It was difficult with the commute and all that. And now that we can offer so much more to each other.
Exactly.
Good. Any other questions from anyone? This is a very unique opportunity. Our first CEO guest. Thank you for coming.
I'm very happy to be here.
We appreciate it's time is the most valuable asset. People don't realize that, and it's like,
Well, I value NAMI very much, so I wanted to be sure to be here, value our partnership.
Mhm.
thank you. You know, one of the things I value most because I have taken my son to Access. He is an Access patient, and his condition is too a little advanced. So, but we go there for medical, and when he cannot attend, they always follow up. The follow up is exceptional, and I don't know if any other people have experienced, but I do, and they have my phone number because he kept losing his phone, and every like 3, 4 months and I'll hear from them. And I don't want to lose the appointment. So I move out another 3 months. And so they're incredible,
Thank you. I'm
very
glad to hear that.
conscientious, very courteous, very supportive.
Yeah, thank you. Glad to hear that. We
Yeah.
don't want anyone lost to care or
Mhm.
falling through the cracks.
Mhm. Mhm.
Yeah. Least we can do in their difficult times, be as supportive. It's the same thing. That's our motto too at NAMI. And then NAMI, a lot of time, at least our group, we not only support our loved ones, we support the family members. A lot of our programs geared by educating, letting each other know because we care for the loved ones. Especially in the severe cases, they cannot speak for themselves. Families stand up for them. Yeah. Do you ever see the HIPAA be a problem? I mean, problem in what sense? HIPAA is always protecting people, right? So we in NAMI, we deal with this a lot. Our
Yeah.
families, they're the only care providers, but an adult child who doesn't understand and thinks it's their right, right? They cannot protect themselves. Do you get release of information? How are those things handled?
Yeah, we have a what's called a care team consent. So when a patient first comes in and establishes care with one of our providers, we ask them to complete it and add anyone to that form that is allowed to speak to us. And it's one of the first forms that comes with registration. That is completely up to them, but it helps decrease a barrier down the road if someone, a parent or a family member needs to speak to us about their care. So it's we handled that at the very beginning. They can update it at any time, add or delete members. So if you ever call Access and you wanted to inquire about your son, first thing we do is check to make sure you're on the care team consent, and then that allows us to speak to you. So it's just a simple form, giving us access, protects the patient under HIPAA, but we try to ensure that every patient understands that this is an option for them to add individual family members. So, yeah.
Liz, what if you're not? What if you're not on that list, or don't have that consent, and you're concerned about uh, someone who, let me see, who might need care, or like my son who's can't see, and we're thinking he needs uh, to be in a more uh, environment with other people. Um, how do you go about talking to someone about this? And if they're reluctant to say no, I want to stay, I like it how I am, when they're not,
Yeah.
they're his environment is, they might have bugs or mice or
Mhm.
something, and they don't know it until someone comes in to visit them or whatever, and then all of a sudden here you are. So just different things like that with
Mm-hmm.
with uh with my son who we're trying to do the best for him. And
Mm-hmm.
yeah.
Yeah, that's a
Yeah.
really hard
Yeah.
position to be in.
Yeah.
I think that was part of maybe the care court
Yeah.
program that the governor was trying to institute,
Uh-huh.
so that
Right.
individuals can be kind of mandated to care. That it's a tricky one.
It is.
It's because you would need kind of power of attorney or
Mhm.
allow him or
Uh-huh.
ask him to allow you to be,
Correct.
to be on the consent because HIPAA protects the patient, right?
Yep.
And
Mhm.
so as providers, we are held to that.
Mhm.
So
Mhm.
um, yeah, it's challenging.
Yeah. Thank you. Mhm.
Unfortunately, no one understands the power and sometimes the obstacle the HIPAA can cause because we, the loved ones of especially severe mental illness, serious mental illness, right? Where it's really painful because limits they don't understand, they cannot give that. So some of us are lucky that we do get that signed up front, but
Yeah, it
Mhm.
is. I know we've run into the limitations of HIPAA that aren't, the best thing for the patient, but yeah,
Uh-huh.
it's the law. Mhm.
now, also, all the systems that you have, like most medical facilities right now, there's a lot, everything is electrical, automated, less paperwork, right? And they have their own, I want to say dashboard, but it's not like my health accounts and all that. They're just all pretty up to date, standard, latest technology, right?
Yes, we do. We utilize Epic, which is the same system that the hospital uses. So that is really useful if any of our patients are inpatient or, to be able to communicate with the hospital. And we have MyChart. So if you're a Kaiser member, you might know, you have the MyChart portal. So we can communicate with our patients, send them messages, they can see lab results. And about 70% of our patients utilize my chart, which is great. And we encourage that because it allows for the most flexibility to communicate with one another. They can send messages to their doctor. So it's a great system of communication.
Yes.
Yeah.
That's awesome. Thank you. Thank you for the service you provide to our community.
Thank you. It's truly an honor to serve. Yes, I appreciated this conversation and all of the thoughtful questions, amazing questions. And we're here. It's going to be some challenging times ahead for our patients, but we will be here. So we'll continue to be here. So
Mhm. Mhm.
thank you.
Thank you, Liz. Thank you
Thank
so
Thank
you.
you so much.
much. And
Appreciate your
Thank you,
time.
thank
Liz.
you, everyone. Mhm.
All right. Thank you
And
all. Have an enjoyable evening.
you too. And we
Take
hope to
care.
see you next year.
Yes, maybe next year Dr. Penny can come. You need to hear her speak. She's amazing as well. She's just fantastic. So,
Yep.
all right. Take
Thank
care
you.
Thank you
now.
very
Thank
much.
you.
Thank
Be
you.
well.
Thank
Okay.
you, everyone.
Bye-bye.
Bye-bye.
How do I stop this? Oh, okay.
Thank you, Marcia. Sorry it was late. I had another Zoom meeting I couldn't get out of.
It's okay because we're recording this and hope we can get that posted on our YouTube account. So check for that maybe in a couple of weeks. I just had to figure out, oh, stop recording. Okay, there we go.